doing a fantastic job. But this is so huge. Jeff, today is Wednesday. The whole Monday, we had a meeting, I posted on my socials. We had an 8-hour meeting with the president, sitting down, asking questions. All of us, the president of the country, let alone me and a whole team of people. Today, the same thing, we've been held up. You've seen that decision to pay those NHIF was a result of a very huge, so more like, a university, lecture room conversations, push and pull, and because can you imagine this huge burden being left in the hands of one person or two persons? Even if I was a CS for health, I would not be able to handle this alone. So this is something that requires concerted efforts from everyone. That's reason number one. Number two, I've given you about my personal experience as a patient, and I really committed to that. That I want people, I don't want people tomorrow, and I want to agree with Senator Onyonka that we should actually have a system that is run by public sector. He talked about, by the way, before I forget, about us public servants. Senator Onyonka, you are right.
Yes.
Do you know, every year, the scheme that you and I enjoy,
yes,
what is called the enhanced scheme,
yes,
runs at a loss of 1.5 billion shillings every year.
Yeah,
every
because we are the ones who want to go to India, we go to Dubai, we are going to Australia.
Not even out there, even here. When the child of a civil servant goes to Aga Khan for normal delivery, Aga Khan was being paid by NHIF 100,000 shillings. For a cesarean, for a normal delivery. The same delivery in Pumwani is 13,000. It's like you'd think the child of a civil servant is going to come from the womb carrying a trophy. Because, it is just wrong, it's immoral. And I believe that we need to look at that.
Absolutely.
That for me is not justifiable. That even those debts that you're talking about, a very huge proportion is contributed by us, public servants. Sometimes, and I was Minister for Public Service.
Yes.
I say if you find a public servant in heaven, you're not in heaven. You're somewhere. Because how can we? And that's the same thing I keep talking about. Sorry, because I want this system rigged in favor of our people, in favor of the common person. How can it be, even for salaries? 1 million people, me and Onyonka, we are taking 46% of the tax collections of the country, leaving the other you guys to 53 million to scrabble for 50. That is a question of us. It's not here. I've said it again and again and again. I'll keep saying we need to have a civil service reform, and we need to have to inculcate a culture whereby we live, like everybody else. Another reason that I'm very passionate about this is primary health care, for the reasons I've said. Even if I fail on level 4 hospitals, and I will not fail, even if I fail on level 5 and level 6, let me ensure that 75% of Kenyans who are using level 2 and level 3, which might not be on Twitter, on TikTok, the tobacco hospital I'm talking about, I live for that. I live for that tobacco hospital, not for the big hospital up there. The other one is about the controls that this system puts in place. We used to have some hospital, and by the way, all the hospitals which were questionable, they used to have a Christian name. It is by a private guy, but it's called St. Peter's. Ukisikia St. Peter's, this is a faith-based hospital. It is not. The amount of fraud that was happening in NHIF, it is unimaginable to imagine how was it surviving. You find a claim being paid
19 times.
No, for 19 times. A claim being paid for maternity for a patient called Njoroge.
Yeah.
When did Njoroge give birth? A patient Njoroge.
Yeah.
Joint hip joint replacement, 19 times on the same patient. Do you know what the new system is doing? Churn it out. Njoroge does not give birth. You cannot amputate somebody. So if we just continue fixing those controls, we're going to save a lot of money. Finally, it is what I'm calling power to the people. What SHA is doing is giving power to the people. Today, if you go to the hospital, you can go to your phone and see all your medical history. You move from one county to another, whatever you are treated in that hospital follows you to the other hospital. Governor Abdulswamad of Mombasa, I come there the whole of January in Mombasa, raised the membership registry to 54% with Governor Abdulswamad of Mombasa, digitized 92% of Mombasa facilities. As a result, Governor Abdulswamad can run Mombasa Health from his home. Because he can see this doctor came for 1 hour, then went to another private hospital there, Pandia. It's being paid by this hospital has got medicine, is screaming. So if it's all these controls, for me, I want to see the good.
Senator, you're going to get...
No, there is good.